Hey guys, Tony Maritato here. So in this video, I'm going to take you deep into creating a gSuites EMR. I'm going to show you exactly what I would do, how I would start to build out some of the tabs. I say tabs because I'm using Google Sheets. I think Google Sheets is a far more effective tool to use than Google Docs when we're looking at an EMR. And I'll explain why, but the main thing is it's just so easy to pull content forward into new pages. So let me get in here and share my screen. Let's say, for example, and anybody who's purchased the Medicare billing course, you guys get this template for free. Let's say this is the template that I'm going to use. This is going to be your master template, right? So if I click on it, go in here. I have not put in all of the tabs that we're going to use because this is a demo. But basically, you have your CMS 700 form. In fact, I'm going to get rid of that too. You have your daily note template. Super basic. No customization in here. This is going to be true. I'm just going to say daily treatment complete. Okay. I can actually do physical therapy. So what I would do is I would take this. Let's go from I get a new patient. New patient comes in. We admit them into our patient management software, whichever one you're using. Most of my demos use PracticeMate as the free patient accounting software. But I would open my master template. I would click on make a copy. And I would name it, for example, Smith P. And then if you want, you could do like 2019-01-18. I always arrange them by year first, then month, then date. We can share it. We can copy comments. I'm just going to leave it all blank and I'm just going to hit OK. And so each new patient that comes into your practice gets a new Google Sheets file. And then on the file, we have this, which is where you basically complete your plan of care. If you want to add additional information beyond the scope of this form, certainly you can add pages. But for right now, we're just going to stick with this. Now, I am a big fan of templates. So let's say, for example, I take this master form, I duplicate it, I come over here, and I might call this non-op shoulder eval. And then I can duplicate it, and I can call this post-op. And actually what I would probably do is take this, put shoulder eval in front. This way I can organize them. Copy, paste, and then get rid of that stuff. Right, so I would do something like that for non-op shoulder, post-op shoulder, non-op low back, post-op low back, non-op neck, post-op neck. You get the idea. And then within each one of these, so for example, let's say shoulder eval, non-operative shoulder eval. Medicare only requires long-term goals, but certainly you can I use short-term goals, impairment goals. For me, typically I will use 4 short-term goals, 4 long-term goals. And I'm going to populate a couple of things because these are generic evals, right? So let's say one of my first goals is increase shoulder, whoops, I don't know why I'm capitalizing everything. Shoulder, active range of motion, flexion to greater than 120 degrees in 2 weeks. And then I might do lift, let's say 10-pound load in affected hand or affected limb greater than 90 degrees flexion in 2 weeks. Right? So you get the idea. I'll throw some goals in here. I would put 2 more short-term goals. My long-term goals might be sleep greater than 6 hours pain-free in 4 weeks. I'm thinking of like the upper extremity functional index, you know, throw piece of paper in waste basket in 4 weeks, pain-free, independent dressing in 4 weeks. Okay, so I have my long-term goals, my short-term goals in there. The plan of care, this isn't about building templates. So the plan of care for me usually goes through the phases of healing. I try to pull references from Kisner, Colby, you know, and other accepted resources within the profession of what the plan of care should involve. I don't just say like 97110 and 97112, and I don't just put codes in there. I actually put something substantial to say that, you know, reduce pain, facilitate function, increase strength in the structures around the tissue, right? So we would put all that stuff in there. And we would build everything out related to a non-operative typical presentation for a patient who has non-operative shoulder pain. They're probably going to have, you know, winging scapula, or if they're young, protracted, elevated anterior tipping scapula, you know, increased upper cervical extension. We're going to have these impairments associated with pain and limited range of motion and decreased strength. They're going to have functional limitations, probably associated with decreased ability to lift overhead, reduced strength due to pain, you know, which makes it so they can't carry a laundry basket. I usually include sweeping, vacuuming, certainly dressing, bathing, grooming, any of that stuff. So you throw all that in there. And then this is what we do. We have a daily note template for the tab. We're also going to create a fax. I'm just going to leave it like that, but really it's a fax cover sheet. So here, fax cover, right? We're going to include records release. You might even include social media release. And we're just going to keep going through, and we're going to add all the things that might be included. HIPAA privacy notice. I had a list of these, but I'm just going through this so you get an idea. Okay, so let's say we have all this information, right? And what we can do, just because I love color coding, so maybe I color code these so that I know, you know, my shoulder evals are orange, and then my back evals are red, and my neck evals are blue. And so basically what's going to happen is, let's say, for example, I've got a patient who comes in and they have, you know, non-operative shoulder pain, and they're looking to start care. And so we want to admit that patient in the account. And so we're going to come in here, we're going to say, okay, so we already said it's Smith, P. So let's say Pat. Provider is going to be Total Therapy Solutions. We don't have an HICN number. Certainly you can change this to anything that you wish. The treating therapist, Anthony Meritato, PT. We don't have to do a medical records number. It is optional. Usually if I am going to do one, what I do is I do SP for the initials, and then I'll do the date, 2019 01/18. And that's going to be their medical reference number. Date of onset, right? So I'm talking to the patient and we determine, okay, it happened Christmas Day 2018. Start of care date, that's going to be the day you're doing your evaluation, right? So in this case, 1/18/19. If you only do physical therapy, you can just leave physical therapy in here. That's not going to be any different. Primary diagnosis, treatment diagnosis, I basically use the same thing. In this case, shoot, I had it in there. Let's do a quick left shoulder pain. And usually what I do with the new codes, because we have left and right, I'll come in here and I usually put left first because that's on the left side. And then I'll put right on the other side. I'll put some space in there. If you want, you could indicate left shoulder pain. And then here we could say right shoulder pain. You know, what I love so much about being a business owner is you make these decisions. You make these decisions based on what's important to you. I'm going to copy these and paste them over here as well. And then we've got visits from start of care. So it's none because we're just starting the start of care. So that defaults to 0. You've got your initial assessment, your history, all that kind of stuff in here, right? Functional levels. You could put in your oswestry or your any index you use. You put in your range of motion measurements. Service dates, we don't really need to worry about that as much as certification. So let me show you a little trick about conditional formatting. So certification dates is usually one of those that's easily overlooked and forgotten, right? So let's take a look at this. And we're going to do some conditional formatting on these two cells. So basically what we're going to do is we're going to add a rule. It's on the cell that's highlighted. We're going to say if the cell is not empty, we want it to be yellow. Not the text. We want the backfill to be yellow. If the cell is empty. If the cell is empty. Okay. So now what happens is I come in here, I type in 1/18/19, and the cell is now normal. If that's not there, the cell is yellow. I do the same thing here, add rule. When the cell is empty, always takes me a second, we want it to be yellow. If I want a little bit of a different color, I can make it orange. This way you can more clearly see, you know, but the idea is, okay, so now I know I need to come in here. I need this to be populated, and I'm going to make my plan of care for 4 weeks. So this has to be populated. And now I do a quick search. There's no color on the screen, right? So I'm going to get rid of that. Other stuff. I mean, it really can be this simple. You can say, well, these cells all need to be populated. So if the cell, isn't this silly that I can't remember, is empty, we want it to be yellow. So if I delete it, I just deleted the rule, sorry. If the cell is empty, we want it to be yellow. Done. Now if I delete Smith, it turns yellow. I type Smith in, it turns clear. So I would do it for this cell, all the cells that you know are going to be required. This is the simplest way to avoid the headache of missing information. You know, all of these cells should be populated. If you want your clinicians to give you 8 goals, require them by color. If you don't care, don't worry about it. But that's been a huge value in reducing errors of documentation, is that conditional formatting option. So now I'm going to show you a cool trick. So let's pretend that this whole shoulder evaluation template is complete, filled in with everything. Now you're looking at this and you're saying, well, how can you have, you know, both right and left? Let me get back in here. Well, it's because when I actually see the patient and we do the evaluation, I'm going to come in here and I'm going to say, oh, okay, it's a right shoulder. So now we've got a right shoulder. Or I'm going to come in here and say, oh, okay, it's a left shoulder. Now we have a left shoulder. So you just delete the stuff you don't need. Tends to be the quickest, easiest way, as opposed to having to research and find and type the stuff you do need. So you know what? I deleted that. I'm going to hit equals that. And so now, programmatically, there is nothing I have to do in treatment diagnosis. As soon as I come in here and we determine it's right shoulder, I backspace, hit enter, it updates both cells. So those are the kinds of shortcuts and programmatic things that you can do just to speed up the documentation. So let's take this. I'm gonna steal you guys for just a couple more minutes. Let's say I do a full-on eval. I'm going to click on this little square in the top left corner. I'm going to hit Control C for copy on a PC. I don't know what it is for a Mac. I'm going to click on that. I'm going to hit Control V to paste. And now I've taken from this tab and copied it onto this tab. And you're probably thinking, well, why? Why don't I just leave it on the original tab? Well, the main reason is because, remember, we're setting additional tabs that programmatically bring information forward. And so I don't know if I'm going to have a post-op shoulder, a non-op shoulder, post-op back, non-op back. I'm not sure which condition I'm going to use. I just know that all of these future tabs are going to pull off of one location. That's going to be this location. And so when I'm setting up, you know, if I click on this, you see up here, programmatically, I told gSuites, hey, gSuites, populate this field with whatever is in this field right here. And so now if I'm making a fax cover sheet, I tell gSuites, hey, this is where you find the patient name. This is where you find, you know, the telephone number. This is where you find all the information. And so as long as this is all populated and has the information that's required, every other tab in the medical record is going to be pre-populated with that same information. So you're not retyping the patient's name. You're not retyping the start of care. You're not retyping blah, 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 blah. And then basically what you do, so look, we know that we have formulas already on this daily note. What I would do is I would come in here. I would duplicate that. I would take this and I would call this treatment day 1. And then I would duplicate it and I would call this treatment day 2, right? And I would just keep going until I had 12 treatments or 15 treatments or 24 treatments or however many you want to do. Now, this is where it does get a little bit cumbersome. So every treatment day should have a treatment goal. And the way I usually do this is I come in here, I hit enter, I come over here, and I grab my first short-term goal. And then I come over here and I click and I hit enter, and I come over here and I grab my second short-term goal, right? And so once you've populated out 12 or 15 treatment tabs and you've got your master template set up, even if there's no information, because remember, you're going to be using your condition-specific tabs for your eval. But if I create, and this is just the way I do it, if I've got 8 goals in here, my first treatment day could be referencing my first short-term goal. My second treatment day references my second treatment goal. Then I've got third day, fourth day, hit all my short-term goals in 4 treatments. Fifth treatment could be an assessment, a short-term assessment, a progress note of where we have come. Sixth or fifth and sixth could be a review of the ones that I haven't addressed. And then I could go 7. Treatment number 7 is my first long-term goal. Second long-term goal, third long-term goal, fourth long-term goal. Treatment 11 is another kind of reassessment of the status or addressing the goal that wasn't met. And then treatment 12 might be discharge. It might be, new progress note, whatever. But there's a systematic approach to that, so that treatment number 1, treatment goal, corresponds exactly to plan of care short-term goal number 1. And so a reviewer can look at this very sequentially and it all makes sense. So this is the rough draft of how I would start using Google Sheets to build out an EMR. You can, of course, beautify all your work. You can import logos. You can do other things. Cool stuff here. So you can get gSuites on your phone. I set up this treatment note. Let me see if it's still formatted the right way, so that we have loads of extra space on the page. Assuming we're not printing this out for anything, why in the world would I not take advantage of this extra space and on my phone snap pictures of my patient, immediately or directly upload them into the gSuites, post it right there, delete the picture from my phone, and then this way we have objective visual. You can use those little apps with goniometers and you can put them on the daily notes. And so at the end of the course of care, you have all these great visual representations of how well your patient is doing. I've toyed with different ideas. Well, what do we do when we're done? I tend to believe that what you would do is you would export every one of those tabs that has content as a PDF, and then you'd package that PDF into a single document so that you could upload it. If you're using PracticeMate, you can upload it into PracticeMate, and it stays with the accounting side of the information. I'm still working on developing the treatment note. I'm going to use these treatment notes a little bit to see how it works, but kind of in the back of my mind, because you guys are probably looking at this, I probably think of something like this would be Therex, right? And this might be bike, and this might be calf stretch, and this might be, foam roll, right? And then you might have your manual. And so then you've got your STM. This is a shoulder we're thinking. So like upper trap, levator scap, rhomboids, right? Whatever other tissues you want to rub. Certainly you can have glenohumeral lobes. And then we come in here and this might be functional activity, and we're doing 10-pound basket carry. And we might do a paper toss times 5 feet underhand. And we might do grooming top of head. And so you've got your stuff, and obviously you can add an infinite number of lines. Yes, you would put how many minutes and what resistance and the seat setting and all that kind of stuff. But what I'm kind of thinking is, so this would be the date of the treatment. So let's say, you know, here's your date of the treatment. You could do, if you wanted to get really crazy, time started was, you know, 08:03 a.m. And then over here, you could say, which I would never tell anyone to do, 13 a.m., right? What I would probably more realistically do is take that time and then come down to the end and say 27 a.m. And then you would get your total minutes based on the difference between the start time and the end time. And then you start your STM at 8:30 a.m. If you use military time, you don't have to do a.m. and you finish it at 8:45, right? And so I think this is probably a more practical way to actually do your total minutes and documentation. But I just wanted to show you that I don't think there's anything else I want to share or use in this video specifically, but I will say that I am going to dedicate the next week to really building this out and adding as much functionality and as many resources as I possibly can, because I want this to be a resource that anybody who has taken the Zero to Paid program, my course for teaching you how to bill Medicare, I want this to be a free resource for you. And I think it brings huge value, you know? So then the next question is always, well, how do you integrate this into the billing software? You don't. I'll show you how to make a form. So if you want to email a form, Google form to a patient, let them fill in some of their information, and then we can integrate the information that comes from that form into this. But there really is just no good way to take this patient and programmatically admit the patient into PracticeMate. But, you know, you're talking about a relatively short amount of time. I mean, I'll shoot a video next admitting a patient into PracticeMate from start to finish. My guess is it takes about 3 to 6 minutes if you have all the information available. So it just needs to be done. And once it's done, you're done. But I'll share this out to the group. I hope this brings you some value. I just put this together. If you see something I'm missing, you know, that everything isn't in here, that needs to be in here, right? I acknowledge that. This is a work in progress. This is a rough draft. This is just to get your wheels turning so you can start to understand what's available, what's possible, what you could do within the gSuites platform. And if you have better ideas, tell us, share them. Like, I'd love to hear what you're doing already, what you think might be better. I'm not going to learn. We are not going to learn unless people like you share your information. So that being said, I hope this brings you guys some value. I'll share it on the group, and I'll catch you guys later. Thanks for watching.